Hello, I'm Matthew Kaufenberg. I'm a physical therapist and owner of Perham Physical Therapy. Today we're going to talk about a common foot ailment called plantar fasciitis. What exactly is plantar fasciitis? Well, plantar fasciitis is a chronic irritation, a chronic inflammation of the plantar fascia. It presents typically with significant morning pain. So you sleep, you wake up in the morning, and that first couple of steps in the morning are miserable. The more you walk, it tends to loosen up, it gets a little bit better, and then by the end of the day, your foot is just achy and sore. You go to bed, you wake up, and the whole process starts over again. Those first couple of steps are miserable. The pain is typically right at the heel, although sometimes it will extend through the entire arch. So, plantar fasciitis, a chronic inflammation of the plantar fascia. The plantar fascia, if we look at this drawing of the foot, the plantar fascia I have here depicted in this blue. So the fascia attaches at the heel, and it comes back over and attaches right at the base of the toes. Its job is to provide support to the arch of the foot. So the fascia can get irritated. The main reason it'll get irritated is because of biomechanical dysfunction. What that means is a bone in your foot is positioned improperly. The most common ones are either the forefoot or the rear foot are positioned not quite correctly. So what do I mean by that? So if we go over to this drawing here on the right, this would be looking at someone from the back, so we're looking at the calf, and here is the heel, and then this would be the toe or the forefoot. So for some of us, we have a forefoot that angles this direction. So we would be looking at someone's right foot from the back. So the forefoot is angled this way. The other common issue is if something is going on with the rear foot or the heel. So again, if we look at someone, this would be another right foot looking at them from the back. Again, we've got the forefoot, and then this section here is your heel. And if you look at this one, this heel is now turned this way. In both situations, one of the bones are moving away from the ground. So if you look at the forefoot, so when we walk, the main job of our body is to get the heel and the forefoot to touch the ground, and then we can propel off of that. In a situation like this, the heel touches the ground, but the forefoot stays above the ground. However, gravity pushes that forefoot down. When that forefoot goes down, it actually stretches the fascia. Because remember, the fascia has an attachment at the base of the foot. So if that forefoot is turned, when we land, that forefoot will slam down into the ground, pulling on the fascia. The same thing will happen at the rear foot. Again, we want the entire rear foot to hit the ground. But when we land on the outside of it. It then slams quickly down to the ground, which then pulls on the fascia. Now, to treat this, we have to treat the chronic inflammation. The way we treat the chronic inflammation is by pushing it out. And we use specialized tools. We call these the FRAMS tools, F-R-A-M-S. That stands for fibrous release and myofascial stretching. These are stainless steel tools. We get into that forefoot and we manually push some of that chronic inflammation out. The most important treatment for plantar fasciitis is correcting the faulty biomechanics, and that is with the use of orthotics. What we want to do, since there's a faulty biomechanic, the ground and the forefoot do not touch, we need an orthotic that will then close that gap. We then also need to do the same thing at the rear foot. We need to close that gap. The orthotics that we use, you can buy an over-the-counter orthotic, and all we do is we take some posting strips and we place them on the orthotic, which then brings the ground up. If you have any questions, please contact me at 218-346-2464.
Thank you for watching Wellness for Life.